So in this table, we are going to focus the anti-arrhythmic drugs. There are 4 groups of drugs we could use anti-arrhythmic or dysarrhythmia. The class 1 is called Procainamide, right? So Procainamide is a drug of choice for dysarrhythmia, or we can tell it can treat the heart rhythm problem, maybe bradycardia or tachycardia. Other name of procainamide are lidocaine. So why this table we are using? We are using this table for compare and contrast. Like class 1, other name is called sodium channel blocker. Class 2, especially beta blocker. More prominently, we use the propranolol. The beta blocker, we use antihypertensive, right? And beta blocker, a group of drugs like atenolol, nadolol, metoprolol, propranolol, or carvedilol. But out of all beta blocker, propranolol has a properties to treat dysarrhythmia. But all beta blocker are adrenergic blocker, or on the other hand, we can say. Particularly beta blocker we use to management hypertension, angina pectoris, congestive heart failure, or to prevent myocardial infarction. So I'm talking about the use of beta blocker, but here we go, and here we are not giving the focus on the use of beta blocker. Out of all beta blocker, we choose one which is called propranolol. Propranolol has a property to use for abnormal heartbeat or abnormal rhythm or dysarrhythmia, right? Class 3, other name is called potassium channel blocker. Potassium. Class 1, sodium channel blocker. Class 3, the drugs we use called amiodarone, right? Amiodarone has a anti-arrhythmic medication. There are a group of drugs we could use as an anti-arrhythmic. Here, this table reflects the anti-arrhythmic, but anti-arrhythmic we also categorized by 4 groups, and here is the group. There are a few drugs has a property can use as anti-arrhythmics. Immunogen is one. Like atropine has also anti-arrhythmic property. Diltiazem class 4 has anti-arrhythmic properties. Most popular drugs we use called digoxin also has anti-arrhythmic properties. Lidocaine, the first group, lidocaine or procainamide has anti-arrhythmic properties, right? So here we are going to focus few of them they frequently use. Amiodarone is one. Class 4 we call calcium channel blocker. Calcium channel blocker is antihypertensive properties. Calcium channel blocker we use for treatment of angina or hypertension. there are few groups of drugs we use as a calcium channel blocker, like Verapamil, Nifedipine, Diltiazem, and Amlodipine. Keep in mind, Amlodipine and Amiodarone is not same. Amlodipine is a calcium channel blocker, but Amiodarone, anti-arrhythmic drugs, potassium channel blocker. Verapamil or Diltiazem, the calcium channel blocker, and also anti-arrhythmic drugs. So when we prescribe these two medication, Verapamil or Diltiazem, to the patient, we could educate them about these two drugs. What we could tell? We teach the patient during the using Verapamil or Diltiazem, if they see the ankle edema, they should report to the doctor office. So ankle edema is a side effect, or during the taking of Verapamil or Diltiazem, they could avoid to operating heavy machinery. So you could ask, what do you do? What is your profession? You can tell. After taking Verapamil or Diltiazem, you could avoid operating heavy machineries. Or also, it is good if patient take Verapamil or Diltiazem, avoid the grapes fruit juice, because this medication interact with grapefruit juice, right? Same like class 2 beta blockers, especially propranolol. When we give the patient, we could educate them, or nursing implementation. It is good before give class 2 or beta adrenergic blocker like propranolol, check the pulse before give the medication. Also monitor the blood glucose if patient has a diabetic. And also it is good give them or admin this medication with food. With food, I said. When time come to withdraw this medication, it is good trap the dose, discontinue. And some of the contraindication of this group of drugs, if we use propranolol, what is it? It is. I said the contraindication, easy way to remember: A, B, C, D, and E. Contraindication. How? What are the meaning of A, B, C, D, E? A means asthma. If your patient have a asthma, it is good not to give them the beta blocker or propranolol, right? At the same time, I could tell you B stand for heart block. If your patient have a heart block, it is good not to give them propranolol. C stand for cardiac failure. Beta blocker protect your patient for MI prevention. But if your patient already heart failure, it is good not to give them. Then A, B, C, and D for diabetic mellitus. If your patient has a hyperglycemia, good not to give them propranolol. And last one is stand for any kind of peripheral disease like extremities, occlusion the artery in the periphery, and good not to give the beta propranolol, right? So the class 1, I'm going to randomly, it is not random, I'm in this table, I'm compare and contrast and starting to together, so it is be easy for you to remember. So here I said the class 1, which is called Procainamide, that is called Lidocaine, right? So this Lidocaine, when you prescribe, keep in mind all of these group drugs, class 1, 2, 3, 4, these drugs will affect the rhythm of heart. Some will slow it down, some will speed it up. Don't focus on how they work, just know the result. It is not our headache how they work. We can monitoring our patient. Basically, lidocaine slow the heart rate, and lidocaine we use for like BTEC or AFib, means indication. What are the indication of this group of drugs? Like class 1 or sodium channel blocker, we use for SVT, supraventricular tachycardia or ventricular tachycardia, shortly called BTEC. Atrial flutter or fibrillation. Basically, supraventricular tachycardia or ventricular tachycardia or atrial flutter or atrial fibrillation, all of this dysarrhythmia. The difference between number of the beat produced per minute, like atrial flutter, atrial fibrillation, both are too much heartbeat is produced from atria, so it is called atrial. Ventricular means the abnormal rhythm or impulse produced from ventricle. It's ventricular. So if your patient has BTEC, AFib, flutter, you can prescribe the lidocaine. But I'm going to focus here, the lidocaine slow the heart rate, right? So lidocaine or procainamide work on sodium channel. So it is called sodium channel blocker, other name, right? The second one is propranolol. We use for, you see, same thing. This is the reason I make a note. When you randomly study, it make a problem. So propranolol also used for supraventricular tachycardia, shortly SVT, atrial flutter, atrial fibrillation, or it is the beta blocker I already told you we could use for hypertension and angina pectoris. What is the class 3? Okay, the mechanism of action, they are non-selective beta blocker. So they work on the receptor called beta blocker, beta receptor, and blockage them, but they are non-selective. Class 3 potassium channel blocker is called amiodarone. So indication of amiodarone we use for VTEC, means ventricular tachycardia or ventricular fibrillation and atrial fibrillation. So if the abnormal heartbeat, too much heartbeat produced from ventricular, from atrial fibrillation. So if you have a look on the anatomy of the heart, it would be easy for you. So amiodarone we use for AFib, VFib, or VTEC is a way. They also slow the heart rate like lidocaine. So amiodarone and lidocaine both slow the heart rate, right? On the other hand, if you give your patient atropine or if you give epinephrine, they also use as the anti-arrhythmic, but for like atropine we use for bradycardia. Epinephrine we use for if absence the heart rate. So atropine and epinephrine both speed up the heart rate, but amiodarone and lidocaine we use as the anti-arrhythmia, but they slow the heart rate. So class 4 or mechanism of action of class 3, they work on the potassium channel and they block the potassium channel. And class 4 we called calcium channel blocker. And calcium channel blocker basically we use as a antiarrhythmic, verapamil or diltiazem. Just let me recap something. All calcium channel blocker end with pine, but here we use the verapamil or diltiazem. But a group of drugs we use as a calcium channel blocker like Nifedipine, Diltiazem, Verapamil, Amlodipine. And the major indicator of this group of drug treat for angina and hypertension. Here, the indication as the anti-arrhythmic are supraventricular tachycardia, atrial flutter, atrial fib, hypertension, and angina. So calcium channel blocker, I said they work on or block the calcium ion or calcium receptor crossing into the heart muscle. If you compare the beta blocker they blocks the epinephrine and norepinephrine from binding to beta receptor nerves. So calcium channel blocker like verapamil or diltiazem, they decrease the blood pressure, they decrease the pulse rate, but increase the heart contractilities. Same group 2 beta blocker, they decrease blood pressure, they decrease the pulses, and they decrease the force of contraction. So particularly calcium floor class 4 called calcium channel blocker. So now go, what are the side effects and what are the note we need for the board exam, NCLEX board exam. So all of these 4 group or anti-arrhythmic drugs, common side effect are hypotension. So lidocaine or procainamide both cause hypotension. Propranolol or beta blocker causes hypotension and bradycardia. Here the amiodarone class 3, they also causes hypotension, bradycardia, and GI upset. And calcium channel blocker causes hypotension, bradycardia, and GI upset. So the beauty of this table, when you study, you can see the common side effect. All of 4 groups can causes hypotension, bradycardia, GI upset, right? Group 2, group 3, and 1. What are the most specific side effect for each groups? The lidocaine or class 1 can cause lupus-like sign symptom, or they cause leukopenia. Penia means number of white blood cell reduce, or they cause thrombocytopenia. Penia means they reduce the platelet number and causes the bleeding. When leukocyte reduce, WBC reduce, patient easily catch up the infection. So NCLEX board asks you, if your patient take lidocaine for a long time, what you could monitor? You can monitor any kind of bleeding spot like ecchymosis, hemorrhage, or patient is frequently attacked by infection. So it is not good to allow so many visitors, or better to avoid the public place because of infection. Second drugs, propranolol, causes, we are going to focus on the particular side effect. They cause weakness or bronchospasm. So if patient has diabetic, or if patient has asthma, we do not give them propranolol. So we hold the propranolol if heart rate less than 60. We never give if patient is asthmatic, never give if patient is a diabetic, right? Asthma and diabetics, because they causes bronchospasm, they causes hyperglycemia. And tell your patient, do not use over the counter or cold medication suddenly without doctor prescription. And the class 3 amiodarone, the specific side effect, pulmonary toxicity. They can cause pulmonary toxicity or liver toxicity. So lungs and liver. They also cause visual disturbance or thyroid dysfunction. If your patient take this medication for a long time, right, we could check pulmonary function test, liver function test. What else? The last one, calcium channel blocker, verapamil or diltiazem. So teach your patient to report if they develop ankle edema. Avoid operating heavy machinery after this medication. Also avoid the grapes fruit juice because they interact with the medication. So here I put something. What are the other medication during the take better to avoid the grapes fruit juice? One is statin, lipid lowering agents like simvastatin, atorvastatin, or I said the verapamil or diltiazem, good not to take with grapes fruit juice.